When you get a sunburn, you're getting damage from both the ultraviolet A rays, which are the ones that are going to affect your collagen and give you that premature aging. And then you have the burning rays, or the UVB rays. And those are the rays that do give you the tan, but they ultimately also damage your DNA. And of course, there is damage also from the A rays. The problem with repeated exposure to the sun is that the sun damage never goes away. Your tan goes away each winter, but the damage from the radiation continues to accumulate in your DNA. And eventually your DNA reaches a threshold where it cannot take any more damage, and the DNA begins to mutate. And that is the start of a skin cancer. Of course, once you have a sunburn, the damage is there. But if you can, within the first few hours, one of the best things to help reduce the inflammation is to take some aspirin. Aspirin has a very strong anti-inflammatory effect, which will help keep down some of the pain and some of the erythema, which is the redness of the sunburn. And then once you get beyond the first few hours in the aspirin, the gels that are on the market, which include the aloe gels and the ones that have lidocaine in them, they will give you topical relief for a limited amount of time, so they will need to be reapplied. The difference between sun poisoning and a sunburn is really no difference at all in terms of what the patient sees. They're going to be red, they're going to be sore. Although when a person says that they feel sick, it's simply because of the toxic effects of the radiation from the sun that have given them that sick feeling. But there is no such thing as true poisoning. It's simply the effect of the radiation into the skin. They've gotten a sunburn, and now they don't feel as good as they did the day before. As a dermatologist, we're not trying to change people's lives to the point where they are a recluse. We want people to enjoy life and go outside, but we want you to do it with the knowledge that you need to protect yourself. You need to avoid possibly that midday sun. You want to reapply your sunscreen, and just keep an eye on your children, especially the young children, and just don't overdo it.